presentation, but I think it's good because it's a plenary room, quite big, so come closer if you don't mind. Yeah. Okay, I will start our session, Health Priorities in the Cities. We have our distinguished panel located here, and we will have presentations, so I will call the speakers one by one. Actually, during the opening sessions, there were several issues how to broaden health agenda in the cities. And I think our panel will be providing very good response how to go beyond very specific health issues and to look from more complex perspective. So I have a pleasure to announce the first speaker, Joseph Torrento from Spain. His presentation title is Applying an Urban Environment Health Guide as a tool for incorporate the health perspective in the urban planning. Some case studies in the province of Barcelona. Dr. Joseph Torrento is a specialist in public health policy and practice in the public health service of the Barcelona Provincial Council. He has over 25 years working in different areas such as scientific practice, natural projected areas management, conservation, education, and community development. He has experience in various fields of public health and is concentrated in the urban and peri-urban health. He is an active member of the cross-cutting group Urban Environment and Health. So we will have from your experience from Catalonia, and you also have a co-presenter, Pilar Cervantes, yeah, who will be also doing part of your presentation. So welcome to the stage. Yeah.
Hello. We wanted to present you our project. This is not scientific work, has no results, has not graphics. It's just a presentation of one cross-cutting project that we are making in our institution in the city, well, in the county council of Barcelona. That's it. Yes. Like we were speaking with my colleague now, this project didn't appear like a mushroom from nothing. Just we have a background and some events that some internationals and some of them nationals that were influencing in the policy of our institution and make the fruit of this cross-cutting group that are working about city and health. In one side there were some international events. Between them there were the conference about health promotion. The first of them, I don't know if is an old one, is from the 1978, the Alma-Ata that was made in Kazakhstan, not far from here, I think. and was about the primary health care, and was introducing already the concept of the equity of health for all of the population, also inside the countries and international. This is the most relevant health conference of health promotion. Afterward, there were some health conferences like the Bangkok in 2005. There was in the 2005 and 6, excuse me, the Finnish presidents in the European Union that introduced the concept of the health in all of the policies. This concept was very important to establish in the 2013 the Helsinki Conference. This was the main meaning of the Helsinki Conference, the health in all of the policies. From this conference went out this figure that represents the main determinants of the health and well-being in our cities. This is connected with the presentation that made before our colleague from Moldavia in the first presentation, that was setting about, I think there were 22 points that are connected with the well-being and the health of the population, but this is sorted by different aspects of the city and the environment. Well, at this point, this was the start gun for us to start with our project. There was internal laws also that were also created in our country. In 2004, there was the law of the neighborhoods. This was managing one big budget in order to make urban regulation as a tool for social equity and to make the equilibrium of health in all of the cities, because there were a lot of differences in the urban areas that were influencing the health of the citizens. Still, there are differences. And there was a group created in the 2005 that was called the Table for the Improvement of the Health of the Urban Health, and from this group, after became the actual group, the cross-cutting group. Our goals in a short resume are three. One of the most important is this, to draw the proposals and all of the recommendations, especially the new ones, to introduce them for the health perspective, to introduce the health perspective in all of what is connected to the urban environment. Also to promote municipal processes to build more healthy environments and cities, and to compile every time, to collect information and to grow the background to apply it on the city projects. Well, I suppose most of you know where Barcelona is located. This is the province of Barcelona inside Catalonia. We are supporting the municipalities. We are not a municipality. We give support especially for the small and medium municipalities in some different aspects. One of them is the health. Also, we support them for the urban planning. And in our project, in the urban health project, are participating actually 14 of our departments and services. I will not read all of them, but the newest one, the last that was incorporated, is the Department of Public Participation, because we think that is very important to take into account what the inhabitants, what the citizens think about the changes that the urban planning are going to introduce. This is a cycling methodology that we used. First of all, we have a pool, a think tank that is providing new tools, new strategies. After the second is all of this think tank, with all of the knowledge, we developed some pilot projects in different areas in the territory. So we choose some municipalities that are interested, and we help them to develop one of the projects, but introducing all of the criteria that were connected with the health. And then, when we prove the pilot projects to be reliable, of course, we have to monitor all of the results. We make this together with the university. Then it's number 4, we supply to all of the involved departments of the group the way the methodology to develop, and they spread this to the rest of the municipalities. And after we start again, we incorporate the new knowledge. So this means to have a lot of contacts and to read and to find knowledge, and then we improve all of the process. One of the tools that we offer to the municipalities is this guide. This is called the Urban Guide. Actually, you can access in internet. All of the guide is published, so it's public, so everybody can raise it. This guide is a collection of all of the scientific evidences that we have, including when there are the best practices that we found, not only ours, just we are interested in other practices in other countries. It's including some recommendations, and it's including a bibliography to check the most recent documents. Now we are making a new version, so all is under revision. Still there is the old guide, but you can find most of the information. This guide is divided in 5 fields. One is the participation. As you see, we give importance to this participation because usually the politicians, they don't like so much to make this kind of processes. But if you want a stable plan that will like most of the population, is needed to make a democratic process of participation, of public participation. The second area is the urban planning. The urban planning is one of the strongest in budget projects that we have. The public and green spaces is also, we did some experience about this, the facilities and the housing. The housing probably is a new area that now is rising a lot, the information about housing and the health. Actually, we have some projects under development. The first of all of them are the tools, the health impact assessment, not only of green spaces, this was the first that we made, but we have also a tool for the urban planning that is under development now. My Pilar Cervantes will introduce you one of the projects, how it's working and how we did it. We have some pilot projects like the connectors of the city with the natural parks or the city with the peri-urban areas that are not built, but they have a lot of biodiversity and usually the biodiversity is one of the factors affecting positively to the health. One of them is this one, Voltem-Olesa. The municipality of Olesa is about 10,000 inhabitants. It's not a big one, but they had the problem that people didn't like to go to the different neighborhoods, so they were very close to the same place. So we make like some tours inside the city, which attractions, because the attractions like places to make a sport, places for the children that you can find in the tour, in the same tour. And like this, the people is connected between neighborhoods and is walking and cycling. That this was the main objective. In other way, there are also some connectors with the natural park of Montserrat. That is one of our main parks, natural parks in Barcelona, and the people can enjoy the biodiversity. We have done already about 22 urban green master plans. 11. We transform some vacant spaces in the municipalities to temporarily used spaces. They can be facilities, they can be green parks, whatever is needed. After we have done 81 vacant spaces and 17 sports and leisure pathways programs. Some of them are arranged, some of them are still now in the phase of construction. And we have one of our pilot projects, is a big project, is the design of the urban planning of the city of Vic. This part is an urbanistic plan and was performed from different multidisciplinary people. A lot of architects, engineers, biologists, physicians are participating, a lot of people. So one of the architects that maybe knows better than me how it's working is Pilar Cervantes, that will speak now.
Well, hello everybody. In the context that my colleague explained you, the Barcelona Provincial Council considered the need to go, this one? Yes, here. In the context that my colleague explained you, the Barcelona Provincial Council considered the need to go one step further in the urban planning and health binomial and promoting the works for the definition of indicators and the methodology for evaluating the impact on health of urban planning actions. The Barcelona Provincial Council, together with the University of Vic and the municipality of Vic, jointly planned this action, and the regional government of Catalonia also participates in some aspects. So we thought, therefore, in a case study that incorporated scientific evidence to urban planning, facilitating the transfer of knowledge between the theoretical field, and political and technical decisions. But how is this municipality? Vic is the capital of the Osona region in the province of Barcelona and has a population around 43,000 inhabitants. It has a municipal area around 3,000 hectares, of which about 3/4 are part of the network of natural spaces. At a natural level, urban connectors like parks or rivers are relevant as spaces that ensure contact between the ecosystems, natural spaces, and populations. In fact, the Medder River has traditionally had a barrier effect of the city, and one of the main proposals of the new urban planning is to turn the river into a regenerating axis of activities. What is the city model that defines the urban planning of Vic? The new urban planning of Vic. The new urban planning of Vic aims to connect scientific evidence with local urban planning, seeking to situate health as an epicenter of the plan's proposal. From this point of view, the urban planning proposes a series of actions to respond to current and future needs, facilitating healthy habits of life. This holistic vision of health leads us to present actions related to aspects as diverse as physical activity, social relationships, or environment, without forgetting the urban landscape. Understanding that it is the set of all of them that will generate a positive impact in the health of the citizens. Likewise, cities' health policy is to encourage to the urban recycling, promoting new urban centers, bringing leisure and culture to the public space, and incorporating sustainability criteria. Then, the objective of the study is twofold. On the one hand, to identify those actions that may have an impact on health in order to be able to track them over time, and on the other hand, to identify the appropriate indicators to carry out this monitoring based on the scientific evidence existing to date. To achieve these objectives, we have worked jointly and in parallel with the University of Vic, which is developing the study called Definition of Indicators and Methodology for Evaluating the Impact on Health of the Urban Planning. The study is not yet finalized, but it does allow to identify a first list of indicators and concludes that there are a series of urban development actions, 34 actions, that have a proven impact on certain health indicators, 29 indicators. Each of these indicators is influenced by some type of urban actions, and some for more than one. This greater or lesser incidence in the indicator is measured by two factors. One is the fact that there are more than one action related to the indicator, and the other is the amount of scientific evidence demonstrated in the work of the University of Vic. In this way, we can identify the actions that have the greatest ability to influence on health in order to prioritize those that can use a great positive impact. While the development of the third and final phase of these studies is still in process, the outcome of the two previous parts already completed is a file for each action of the urban planning, collecting its impact on the health indicators, as well as a qualitative assessment of this impact. The content of these are type of action, execution forecast, typology. We see mobility, public space, facilities, urban land, transformation, and open spaces. the location in the city, the description of the action, the impact on health determinants, and the impact on health indicators, and the conclusions. The different shades of gray, I don't know if you see that, but there are different shades of gray displayed indicate the amount of scientific evidence supporting the relation between the indicators and the actions performed. And then there are the conclusions. I don't read it, but only the last one. The global action on the push of the use is one of the actions of the new urban planning, is outlined as the action that potentially presents a greater impact on the different aspects of the health, and that therefore it will be necessary to prioritize from the point of view of the management. And this is all, and thank you very much.
Thank you very much, Joseph and Pilar, for your presentation. So we will shift the questions towards the end of all presenters. So now I'm happy to move to announcement of the second presentation to be presented by Ivona Ivaniczka. Title is Healthy and Active Aging in Lots. Ivona Ivaniczka is from Poland. Since 1992, she has been working at the Department of Health of the Lodz City Office for the past 5 years as a deputy director. She initiated activities in the area of health promotion, health education, and prevention of the disease on the city level of Lodz. At present, she is responsible for health promotion, prevention of addictions like alcohol, drug addictions, and violence, activities stimulating and supporting active aging at the city level. She is also involved in the healthy city movements in Poland since 1992, cooperates with WHO Office for Europe as a healthy city coordinator in Lodz, and as a president of the Polish Healthy City Association, its national network of healthy cities. The floor is yours, Joanna.
Mr. Chairman, ladies and gentlemen, good afternoon. Thank you for introducing me. I work for the municipal Department of Public Health and Social Affairs, which is local government. So I'm going to present some practical initiatives and examples of our activities, which we hope help elderly people to stay healthy and active in their life. The city of Lodz is located in the central part of Poland, a little bit 130 kilometers southwest from Warsaw. This is the third biggest city in Poland, and we are a twin city with Odessa. We used to be a typical industrial city in 19th and 20th century with a very strong textile industry, but now these textile factories don't work anymore, and buildings are used for different purposes after, of course, revitalization, for example, as a shopping mall. Number of inhabitants in the city is about 700,000, but about 30% of them are over 60 years old. It is a big challenge for the city authorities also, and that's why about 6 years ago we started to introduce special initiatives for address to those people. In the past, we cooperated with the elderly people in the city by NGOs, but only by supporting these NGOs. But 6 years ago, we started to introduce our own projects. We established a small unit within my department, Department of Health and Social Affairs, and the goal of this department is to stimulate activity and improve quality of life of the elderly people in the city. And all activities have a common label, Active 60+. And I'm going to present shortly all these activities because I think there are quite a lot of them. We started with district centers of active seniors. In fact, we used resources which already existed. So we didn't build new buildings, we just used places which were well known by people. We used local district cultural centers. People know them, some people used to come there for any activities. So we just added some extra money from the city budget to create new kind of activities addressed to the elderly people. There were lectures, and they are still there, of course, so it's still going on, all these activities. Lectures, computer classes, cultural events, and also psychological and legal advice and counseling. This year we started to build another network of centers supporting elderly people. This time it is based on outpatient clinics, which some of these outpatient clinics in the city belongs to the city. So we found buildings which can be used for this purpose. We prepare special infrastructure. So in these centers there are also lectures, there are space for rehabilitation, but there are also computer classes, there are counseling, and also telephone helpline for seniors, and space for bottom-up initiatives. And all these activities are available free of charge for people coming there. City Senior Card. It's very simple, and I think it would be very easy transferred to other cities, because it doesn't cost the city almost anything. We just produce a card, and people living in the city are allowed to apply for it and get it for free. But an offer which is created by partners, there are at the moment over 180 of them. There are discounts for services given by these partners, not by the city. It's not paid by the city at all. So it's very, I think, easy and not costly, but very attractive, because you can go to a restaurant and pay less. You can go to a book store and pay less, to shops, schools, different courses, language courses, for example. You can just use these services on lower prices. Box of Life, another initiative. It's also very simple and not expensive, but can be very important in emergency situation. It's a small box, as you can see here, and basic information about health status, about regularly taken medicines, and contact details to the family member should be placed in this box, and the box should be placed in the fridge. In an emergency situation, when emergency service comes to that person who lives alone, and it's not possible to communicate with this person, all these basic details are in this box. So doctors can faster and easier help the sick person in this emergency situation. And as you can see, the color is very visible, and if the box is in the fridge, there is a label also on the fridge And emergency services in the city, they know that there is such system, and as you can see, there is a member of these services, so they were informed. Why fridge? Because usually fridge is in the kitchen, so there is no reason to look where the person put the box. If it is there, it is in the fridge. Internet for adults. Elderly people are really very interested in computers, but their skills are very often on a very low level, so they are really interested on computer courses, and every year I think more than 1,000 people attend these courses. They are free of charge for those people. And we also organize workshops for people who already got basic skills, but they want to learn how to use different websites, for example, National Health Fund or Social Insurance Company website or public transport website on different websites also. 60 plus volunteers. So there is a group in the city, elderly people also, who want to be more active. There is a kind of link between the local society and the city office. They are invited every month for a meeting to the city office, and they are informed by the city, by my department, about current activities for the elderly people, which are going to happen in near 1 or 2 months. And they are taking this information in a written form to their neighborhoods, and they are informing about this offer their neighbors and people they meet in the shops or in the local cultural centers. Internet is very important, but some people still prefer written form of information. So we created lots guidebook for seniors with basic, it's a kind of telephone books. There are not a lot of space for information, just basic information with telephone contacts and addresses in the area of health, social services, aging and disability or active life in later years. And this printed form is very important, and it's available free of charge in these active centers for seniors or other buildings, all buildings of the city office. And in the same way, we distribute information about current activities. It's a seniors envelope. We print it every 3 months, and senior citizens can find offer of current activities about different events, workshops, physical activity classes, and it's available in many places in the city attended by the elderly people. And we print it in a quite large, quite big number of copies. So it's really, because the same information can be found on the website, but for those who don't use internet, still there is a printed version of it. And that's the project. It's a cooperation with social insurance institution for newly retired people. So every newly retired person with a decision on granting a pension gets an invitation to the city office for a meeting, information meeting, because those people usually who used to be active working for many years, sometimes, I think very often, are not aware that such offer for the elderly people exist in the city. So that's the chance for them to inform them, and if they want to use this offer, there's a chance to get know something about this offer. Prevention of diseases. We are Department of Health, so we try to offer some medical medical services to the elderly people. for more than 10 years, or at least 10 years, we offer vaccination against flu for lots of citizens over 65, and the number is not enough. As you may be aware, it's not very expensive, but for the elderly people, even the small amount of money they should pay, it's maybe a problem. So we offer this vaccination free of charge. In the nursing homes supervised by the city, last year we offered pneumococcal vaccinations for residents. It was just once, because you don't need to repeat it every year, and everybody who wanted had this chance to use these vaccines. We also offer a consultation on cardiovascular diseases and a kind of education and lectures and meetings, and because as you can see, the 75% of these residents, they have risk factors like high blood pressure, overweight, low or obesity, or low physical activity. And these lectures and different activities are offered also by NGOs, but paid by the city. So everything we offer is free of charge for inhabitants. Municipal daycare center, it's very new. It was opened this spring. It's a kind of, I would say, nursery or kindergarten for the elderly people who, after a stay in a hospital, shouldn't stay at home alone. It's a help for the family, because sometimes the other members of the family are not able to take care of this person for the whole day, but they can bring that person to that home, stay for the whole day. There is food available, there are rehabilitation and activity classes, so, and if free of charge, paid from the city budget. Senior City Seniors Council. There is a council. It consists of 15 members elected by elderly people, recommended by elderly, but by NGOs working for the elderly people. So they represent elderly people and problem of the elderly people to city authorities. So they meet regularly, and the city meet with those members, and we know the biggest problem, the biggest challenges which are reported to the city council by senior citizens of the city. Senioralia. It's a very visible event in the city. Maybe it's nothing new. I mean, the purpose of this event is just to show that there are a lot of activities in the city addressed to elderly people, and maybe not all elderly people know about this permanent activities going on all over the year, but in May, over the week event is organized, and it's very, very visible, starting with the official opening with the mayor of the city, and after that we offer activities in 5 areas which can be used by the elderly people, and the additional advantage that elderly people can use public transport to reach these activities, or even not for this purpose, just during Senioralia, public transport is free of charge for the elderly people with the senior card, but it's just a formal thing to get it. And as you can see, some numbers from this year, Senioralia, 13 days, 125 partners offer different type of activities for the elderly people. 700 events took place, and over 60,000 participants attended Senioralia this year. Website for seniors. As I said, everything we offer for seniors is available on the city website, and there are also links to other websites of other city institutions which offer some activities in the area of sport or culture or green spaces. And as you can see, it's quite often used by elderly people. Conclusion. I think that Active 60 Plus project helps elderly people to stay active, to feel useful, and there is also a message to the rest of the society that elderly people have their own rights, they have their own needs, and they can be also treated not as a resource for the other part of the society. Thank you very much.
Thank you very much. Ivona, a really great example of your work in Lodz. So let me introduce the next speaker, Pieter Verwoost from Belgium. Title of his presentation is Vocability in Flanders, Analysis and Opportunities for Spatial Policy. Pieter Verwoost is an engineer in the field of architecture and has a degree in urbanism and spatial planning. He has been working for more than 12 years for the government of Flanders within the Department of Environment and Spatial Development. He coordinates and conducts policy-related scientific research on spatial and environmental issues and process in Flanders. The floor is yours.
Thank you very much. Before beginning with my presentation, I do have to apologize for my presentation today, because in Flanders they are really proud to have their own font, but I forgot to include it. So normally this is in a really nice font, but now you have the standard Microsoft font, I think, but still. I would like to thank the organization, the committee, for this excellent organization of the conference, and also the city of Odessa for their warm welcome here. A conference on health is actually not very healthy, is it? Our health agency advises to walk for at least 10,000 steps a day, and nowadays, in our phones, we have all an app to tell you how many steps we took. Let's see, 2,900. So I really have to be very active this evening. And actually, our modern lifestyles and jobs do not make it very easy to stay active during the day. Okay. So this is an average week in my life. I wake up, commute to work by train, sit at my desk most of the time, and then take the train back home. So it's not really easy to achieve a 10,000 steps target. And actually most of the days I succeed. It is because I cheat and I go running in the evening. But still, I think I'm doing better than average in my country. Most people commute by car, and even they use cars for distances that can easily be done on foot or by bike. At this conference, I probably do not have to explain sitting too much and lacking physical activity is not very healthy. I think this morning we saw some presentation about it too. And depending on your age, different health relating issues occur. For adults, for instance, there is a higher risk on chronic diseases like diabetes, obesity, arthrosis, increased blood pressure, and so on. 60% of adults in Flanders sit more than 8 hours a day, and almost half of our population is suffering overweight, and 13% is obese. We could improve our daily amount of physical activity by going on foot or by bike on a daily basis. But depending on where we live and how you live, this is of course easy or more challenging. In a dense city center, shops, schools, jobs, they are all at walking distance, but in more remote areas, distances are more far and people will go by car. So where we live and how we live, the characteristics of our built environment, they really define the potential we have for active mobility. And organizing the built environment is, of course, the field of spatial policy and practice. And that's why we wanted to know which locations have a high potential for active mobility and which locations could be improved. That way, healthy spatial planning could help to improve our lack of physical activity. International research found a strong positive correlation between active mobility and three characteristics of the built environment. The researchers, they developed a score for neighborhood walkability using this formula. The components of the score are normalized, so they rank neighborhoods in comparison to each other. Most important is the street connectivity. Being on foot, you will like to keep distances very short. So in a neighborhood with a lot of crossroads and a dense street network, this is of course very easy. But if distances get too large, people will easier switch to other passive modes of transportation like cars or motorcycles, the bus, and so on. Second, the residential density. Living in a high-density neighborhood will increase, of course, the chance your friends or relatives live close by. You can visit them on foot, whereas in low-density neighborhoods, distances are likely to be larger, and again, you will most likely go by car or another means of passive transportation. Also important is the land use mix. Mind you, this is not the total amount of different kinds of land use like a school, recreation, retail, offices, hospitals, but rather how well they are mixed. So when we have a lot of different important functions close by, it is very easy to, for instance, drop off your kids at school, then go to your work, and then do your groceries and go back home just on foot, if they are really close by. If they are further away, maybe you can do some of it on foot, but then you really have to take a car or another means of transportation to carry on. Bit of geography. This is where we are. I work for the government of Flanders. This is the northern region in Belgium. So you can see where we are. And together with the Flemish Institute for Healthy Living, we collected all the necessary data to compute this walkability score, and we managed to map it for the entire region. And these are our results. Okay. So this map shows the walkability for the urban settlements only. We've made several maps, but this is the one with only the urban settlements in Flanders. The blue color indicates a high walkability, more healthy. We discussed whether high should be red or blue, but we think red is bad and blue is better, so we switched the colors around. So the red scores are the neighborhoods with low walkability. And at first glance, you can see larger cities like Ghent, Antwerp, Bruges, they stand out, they are really walkable. Whereas the more smaller towns and villages, they are less walkable. But if you look at the chart, you can see that there are only actually few really highly walkable areas in Flanders, and the average score is rather low. Well, In Flanders, we have a really fragmented urbanization pattern, a lot of urban sprawl. In fact, most of the urban planners will tell you we have only sprawl, we don't really have a large city. So a lot of homes are located in less urbanized or less dense location with a rather low street connectivity, hence the walkability is really not very good in Flanders, of course. But however, this is not everywhere in Flanders, and you can also see in rural areas or some urbanized areas which are not really a city, the walkability score is better than average, and most of the time these are historical cities with a really historic or history of dense urban pattern development. If you look at this map, these are the dark blue areas. These are the best scoring ones. And mind you, this is only 20% of all neighborhoods in Flanders score best, so 80% is really not very good. And in my opinion, spatial planning in these dark blue areas should focus on implementing more pedestrian-friendly infrastructure, especially in those areas where low socio-economic status can be found. And from an active transportation side of view, these are the areas likely to be considered for future development. In the less walkable location, I think spatial planning should be more cautious. And you really have to look at other parameters like, for instance, the public transport network, where is it located, where is the concentration of jobs and so on. So in some areas you can try to increase the walkability. At other locations, maybe the physical activity should be enhanced in a more selective way or in another way. For instance, at local level, this is my hometown, Turnhout, in the north of Flanders. And you can see clearly the city center scores high. And in other areas, walkability could be enhanced. But there are also some neighborhoods where the perspectives are less clear. What should we do with the areas marked with the question mark? And if you look at new urban development areas, for instance, in the north of town, this is an extract of the local spatial policy plan. So they want to create 3 new developments over there. And if you look at the walkability map, you can clearly see that the walkability existing right now is very different. So different measures to enhance the future walkability or ensure the future walkability should be considered, depending on the underlying components, the 3 components we discussed already. Together with the Institute for Healthy Living, we also developed an online and interactive tool for analyzing walkability at the local level, because we have a lot of local municipalities, 308 for a really small country, so the capacity of these municipalities is not very high in terms of knowing how to process these maps and how to use these maps. So we tried to make an online tool they can easily use just on the web. You can analyze the different components of walkability of one area, which you can see over there. So we have indicated 2 areas, and then you can see what the components are, how the score is, and you can also try to check what the difference is between 2 areas. So if you have 2 areas that look the same but they have a different walkability, then you can go and check what is the difference over here. Or if you have 2 areas with the same walkability But one is because the land use mix is high, the other one is because of the street connectivity. You can try and find how can we improve walkability in these areas. We also included several overlay maps, so they don't have to find them themselves and try to make the overlay themselves, like the transportation network and socioeconomic data. So they can really try and use this data as well to try and implement walkability as one of the new things to implement in a spatial plan. Now, this tool has been tested by several municipalities to ensure that they can work with it and know where everything is, and that it is really useful for local policy making. And it will be launched next week at the conference on healthy public space in the Parliament of the Government of Flanders. But if you go to that website, you can already see a test version. I'm afraid it's in Dutch only, but it's pretty comprehensive, and I think you can find your way. So you can, if you just surf over there, you can find our tool. Okay, this concludes my talk today. Thank you very much for your attention, and a special thank you for the interpreters at the back for their good job interpreting me in Russian. And I would be happy to take some questions after the last speaker. And you can contact me later if you want some more information. Thank you.
Thank you very much. Really exciting presentation. And our last speaker at the session is Lewis Rайс with presentation, the integration of public health into university campus developments to improve well-being. Dr. Lewis Rайс is a senior lecturer, architect, and theorist specializing in health architecture and healthy cities. Joining the School of Architecture at the University of the West of England, UK, as a part of the World Health Organization Collaborating Center for Healthy Urban Environments. His research focused on healthy and sustainable urban design. He is the author of numerous books and articles on architecture and urban design, and was recently part of the organizing committee of this 2018 International Conference on Health.
Thank you very much. Thank you. So I'm Dr. Louis Rайс. I'm originally an architect and kind of urban designer by training. I spent the first 10 years of my career in practice working as an architect and designer, mostly in the UK, but also in France as well. For the last 10 years approximately, I have been working in academia at a university in the UK, the University of the West of England, which is based in Bristol, which is about 100 kilometres west of London. Part of my, the research side of what I do is with the World Health Organization Collaborating Centre for Healthy Urban Environments. What's partly unusual, most of the world, or many of the World Health Organization collaborating centres are looking more at kind of medical health. They're looking at maybe heart disease and are often in medical departments. When this was set up, it was only one of two in the world that was in a department of the built environment. So it's trying to look at the relationship between the built environment and health, but particularly trying to be kind of proactive about that. So trying to make cities healthier, or enable or promote healthier lifestyles. The title is The Healthy University. So the focus of this bit of work and a bit of work which is just emerging or just beginning to do is looking particularly at university campus developments in the UK and how we might improve well-being. Using the term well-being in a kind of the loosest sense, it's got a very specific term, but people are using it kind of as a kind of positive aspect of health. I've put the picture here. This is Hieronymus Bosch. It's 500 years old, and it's the Garden of Earthly Delights. And I wanted an image to, I guess, capture the idea of designing. When we talk about university campuses, not just a place that's maybe safe or has low kind of risk factors, but something that's like delightful as well. So it raises a question of what kind of environments do we want to live in, what kind of cities would we be happy in, would we enjoy. So trying to look more positively and maybe creatively about cities and urban environments we want to live in, and using the kind of university campus as maybe the catalyst for that debate, I guess. Okay, so just to put this into a little bit of perspective from a UK context. So we've heard from various presentations this morning about the issues of obesity and overweight. The UK is catching up with America. It's leading Europe on obesity, which is not maybe a record that we want to have, but anyway, we're doing very well. Even a quarter of our pet dogs are obese or overweight. So it's not just humans, we're really doing very well on lots of living organisms. Connected to that are a range of illnesses such as diabetes. And I guess I'm raising those because these are often described as lifestyle diseases. So a lot of these are very long-term illnesses or health conditions that develop over kind of decades. And in some ways, as a kind of architect and city designer, that's the time scale. So if we're going to change cities, we know you're looking at kind of 50 years to maybe or longer to make kind of significant changes to cities to health as well. So there's a kind of parallel to a lot of the prevalent diseases in the UK and the kind of timescales of city design. Just to give an idea of the scale, in the UK, there's just over 2 million students. Roughly half of all school leavers go to university in the UK, so broadly the majority, well, just over the majority of the population will have gone to university. I was chatting to somebody earlier and they were saying that in Boston, in America, there's over 1 million university students, which I didn't know, there's such a huge population. So it's kind of, you know, there's a huge kind of global, I'm mainly talking about the UK, but obviously there's a big population of students. And I guess specifically what are the kind of health issues that we need to deal with, and in the UK is mental health. In the news, there's been a lot about kind of suicide rates in British universities. There's been a kind of spate. Part of it is just more reporting on it, but there is a rise in suicide or attempted suicide in UK universities. And also just in a context of the prevalence of the development of mental health diseases in people in the kind of 16 to 24-year-old age group. Obviously, I'm aware that there are people of all ages, the aging sector, third age universities, but still the majority of all university students are kind of under 25. And as well as other health issues, kind of mental health, often related to kind of social health. So despite it being a very sociable time, often isolation and loneliness are kind of big factors as part of that. I put this slide in just, the image on the right is London, and on the left is a big city in Asia. And I just wanted to remind us that regardless of culture or climate or context, most cities, big cities that we're developing, or big urban areas around the world are really quite similar. Prevalence on the automobile and kind of city development. So very hard to tell the difference despite different sizes of the world and very different kind of cultures. What's obvious on this is air pollution is very, very visible, mostly caused by car traffic. And we've had presentations on the issues of that related to sedentary lifestyles, but also kind of more immediately air pollution, as well as noise pollution, leading to things like sleep deprivation or sleep issues as well, and sedentary lifestyles. The previous presentation, it's great to see, you know, what this encapsulates is we mostly live indoors, so sort of recent research saying that we spend 90% of our time indoors now. So the vast majority of all human experience is in a kind of architectural setting, particularly for universities in rooms like this, which are windowless, there's no natural air, no natural light, and we're sat down for pretty much all day long. So kind of lots of health issues. There's a debate about whether we should start doing standing lectures in our university and whether it's still accepted just to seat everybody and not give any kind of alternatives, whereas actually there's slightly contentious data or statistics that sitting is equivalent to kind of smoking 15 cigarettes a day, and if we asked you to smoke a packet of fags, you would kind of be a revolt or something, but there's no problem with the sitting for long times. And there's just a little comment there about that, about should university campuses be exemplars of healthy urban environments? In the UK particularly, because they're effectively paid for through, or until recently, taxpayers' money, maybe they should be more of a catalyst, I guess, for what a healthy part of a city should be. And often they're the main employer in a city as well, so they could have a very positive role. Why is this important, I guess? This very simple diagram. So the healthier you are, the more likely you are able to learn. So in a university setting, it's quite an obvious thing. And then in a virtuous circle, the more educated you are, the more likely you are to be healthy. So as I said earlier, the majority now of the population in the UK is going to a university. Education and health are kind of wrapped up together, and as part of a wider population change, I guess, towards a healthy population, there's lots of benefits between those two things. The comment is about, at the bottom, is about a settings approach. Some people call it place-based kind of health approach, particularly with the role of mayors at kind of city level, so trying to take national policies and really try and make impact in the real world through kind of places is very important. As an architect and a designer, obviously I'm focused on buildings and spaces between buildings and public spaces, but I'm aware of how important the softer kind of issues are as well. However, I will focus more on the built environment. There's already some progress in the UK about healthy campuses. This is just one example from the University of Sheffield, which is a big university in the north of England. And they have a healthy campus strategy. As you can see, there's 8 kind of spokes, I guess, and 7 of them are related to different aspects of well-being. A number of universities have these kind of health diagrams, but they're all very different with different strategies. There's no really coherent thinking. It's great that they exist, but there's still a lot of work to be done, and there's very little evaluation of which ones work, if they work at all. Just put it into some kind of context. I was pleased to see that Joseph and Pilar had this image on the left, so I wanted to show that actually this map is very widely used. It was 2 colleagues of mine who developed it about 10 years ago as part of the WHO, and it's really looking at, it's based on work by Dahlgren and Whitehead from the WHO, which looked really broadly at integrating policy decisions, and this was trying to bring it to kind of urban planning, either from a kind of national scale down to kind of city planning. As you can see, section from the global ecosystem, natural environment, built environments, to try and get planners or anyone involved with the development or design of cities and land use in a country would try and integrate thinking. It's been very influential, as you can see, even in Barcelona it's being used. On the right-hand side, I've worked with one of the producers of that image to look at this for more a kind of finer grain. So whilst this is great, it wasn't really of use for architects, or perhaps maybe, or to some extent more for urban designers, but architects don't really use that. So we're trying to develop a map that's of use to kind of architectural designers. So looking through the key aspects, so materials at the people at the heart of it, then going through to materials, so the bricks and mortar, what are buildings made of. The map is not kind of declaratory. There's no one right answer, but you can look at it. So there's a prevalence of synthetic materials used, so lots of plastics and polymers, which say affect air quality, for example. So there's a shift maybe towards more natural materials. Spatial level, so that's so maybe when you design you might want to have natural views of greenery or something like that, so how are you laying out your building in relation to its context. Services go through to, you know, this room will sit all day in artificial light, air conditioning, probably not a very nice space. It's probably quite a relief when we get out of there. So there's a shift or a prevalence for lots of people to have natural daylighting, natural ventilation, natural heating and cooling if we can do that as well. And then as we go out, it's slightly more maybe nebulous terms, so things like control, which is just how much control have you over the space. In a room like this, we can't really control the lighting or the heating. It's controlled by somebody else. But it can be little things like when you work in your office, can you make it hotter or cooler to make it more nice? Can you personalize the space in which you work? Can you close the curtains or draw the blinds? Through to much wider things about kind of affordance and agency in a development. Then it goes through lastly to activity, so trying to encourage more activity or exercise within the built environment. Often when you get to a conference centre or a hotel like this, you're faced with a bank of elevators. Often the stairs, this isn't too bad, but the stairs are hidden away. Sometimes they're actually alarmed, so you can't use those. And it's trying to shift or nudge us into maybe healthier environments as well. As part of that activity as well, it's also space for activity. So a lot of places in the UK, you can't cook in a kitchen. They aren't designed even for cooking. There's no space for bicycles or storage for any level of activity as well. So it's kind of thinking holistically about those. This is about restorative space. So the idea behind this is that certain parts, mostly natural environments, can restore health, so they have a positive effect on your well-being. There's a whole list of claimed benefits and sometimes evidenced. We learn faster, we heal quicker, soothes pain, reduces crime, adds economic value, improves well-being. So a whole range of possible benefits. I chose this particular, I just find it very beautiful, very calming just to look at that image. And one of the benefits of, or one of the maybe peculiar things about restorative space is that we don't need to even think about it. We just need to see, say, greenery, and it will calm us down without us even being aware of it. So we're not sure of the cause of why it's happening. They think it's maybe genetic or because we grew up in nature. But just the prevalence of or existence of greenery calms us down and produces on the benefits as well. So this was just a little project we did with some of our undergraduate students, and we looked at the prevalence or the level of restorative views of nature on the campus I work in. So there's about 30,000 students on our campus, and we got students to go around all the different teaching rooms in the campus. There's just over 100 of them, and take kind of photographs and statistical data. There's methods that have been quite well developed now about how you would gather this data and evaluate it. On the left is a typical, probably quite uninspiring view from one of the teaching spaces. And this is just very early, quick data, I guess, just to give you some idea. So there's not one of the views has a complete view of nature. So there's not one window on the campus that actually just looks out onto nature. The vast majority have either no view or almost no view. On the left, there's no window. And initially we thought, well, maybe it's like this. There's some technical reason why a lot of the rooms don't have nature or windows at all. But actually speaking to the designers, particularly the newer buildings, it wasn't a consideration at all. It was often aesthetics. They didn't want a window in their elevation, so they took them out. Or it was cost, that glass costs more than just a breeze block and insulation. So they weren't to do with the functioning of the rooms, but for other reasons. It's worth pointing out as well that this campus, there's huge amounts of open space. The buildings take up only 17% of the whole campus, so over 80% of it is, over 50% is green space, and there's lots of open space. So it's a design decision, or it's a lack of thinking about design that has led to this situation, I guess. We're kind of looking at working with the kind of estates department again and seeing how we might implement and change it, because I don't know about the campus you're on, but they have a kind of ground zero attitude to cutting anything that's living to kind of the minimum, and maybe just allowing trees to grow or to nature to actually do what it does naturally. Would be able to be cheaper and have benefits for the university. I was in Peru recently, and this a little bit hard to see, but this building's really interesting kind of exploration about how you might do it differently. It's not a window on the right-hand side, it's like almost a tennis court mesh, and that's only to keep the wild deer and iguanas from walking into the classroom. So it's a very unusual campus, a very different climate. So it's completely open to the environment. The ground, kind of the external ground comes in, so you're really at one with nature. The campus has been designed so that you can't hear cars or anything, but you can hear bird song and the deer nibbling and stuff like that. So it's a really embracing trying to use green infrastructure or nature-based solutions as part of improving the student experience, improving kind of well-being and kind of restorative architecture, I guess. The use of new technologies, I would have liked to have spoken more about that, but the research just isn't proceeding fast enough. So we're working with some very clever people at the Bristol Robotics Lab who do a lot of artificial intelligence and using amazing clever computer stuff to capture real-time kind of emotional data. So using kind of facial recognition to understand whether people are happy or sad or stressed, and trying to gather much more detailed and real-time data on the emotional status of people as they use a campus. I don't know whether you noticed, yesterday Apple did their new announcement on their new iPhone and watch, and they have a new thing that on your phone, on your watch, if you constantly monitors your heart rate, and if it drops between a certain rate, it will automatically call an ambulance for you. So it's kind of very well connected. But although there's a huge amount of data on wearables, apparently in the last 3 years, more data has been produced, digital data, than in the history of all digital data beforehand. So particularly through wearable technologies, there's vast amounts of data coming through, but almost nobody's being able to analyze it or analyzing it for any particular use. But in terms of trying to understand more continuous knowledge or data or evidence about the impact of the built environment on health and emotions and well-being. So it's probably another year away from kind of more meaningful data on that. Just last two things. We need more integration and collaboration, that's obvious. And I guess partition from stakeholders, so we really need to kind of work with users. Anyway, thank you very much.
Thank you, Luis, very much, and thank you to all great speakers, all great presenters. Unfortunately, I cannot allow the Q&A part as a formal one, because I need to close this session. Nevertheless, if there are questions, I'm sure there are questions. By the way, are there questions? Yeah, I encourage you to come here to the panel and ask one of the translators also to join, to have it as a follow-up discussion, please. But for the session, I was asked to close it sharp at 3. Thank you so much. Thank you one more time for the great presentations. Yes. Yeah, please come. I think it's those who have questions, please come here.